So today I've got Janet Lowndes with me, and Janet's going to speak to you about yoga therapy.
Hi. So I've been asked firstly to just introduce myself, and I am a yoga teacher and yoga therapist as well as a psychologist, and my original training was in psychology, and after having worked individually with clients with all sorts of mental health issues, I moved away from psychology for a while and went to study yoga in India. And it was really through that study of yoga that I discovered a different way of working therapeutically with people from a different paradigm, really a paradigm that taught me that a healing relationship could be one that's not so much about changing people or fixing people, but rather about assisting people to discover their own true nature. So what I do now is work individually with clients from really a combined paradigm from the yogic perspective and the Western psychological perspective, and the combination to me really fits very well as a yoga therapy approach. So that's most of my work now.
Mm-hmm. Yeah, so if you want to talk to us a little bit about your understanding of yoga therapy, and you also mentioned the difference between yoga therapy and therapeutic yoga.
Yeah. Look, I think yoga therapy is really about the individual healing use of yoga, or the healing power of yoga. And for me, what I consider to be the difference between therapeutic yoga is that therapeutic yoga is about conditions. So for example, you could have a therapeutic yoga class for depression, whereas yoga therapy is about people. And people we're all different, and even though we may be experiencing a condition, for the depression example, 5 different people all experiencing depression are 5 different people who all have different needs and all will require different therapeutic work. So my feeling is that we have a bit of a continuum, and at one end is general yoga classes that can absolutely, all yoga is potentially therapeutic in nature. And then from there we go to therapeutic yoga, which is very focused on particular conditions, and people with those conditions might come to a therapeutic yoga class, and that they can learn a lot about how they can manage those conditions or make changes to their lifestyle and practices to enable healing. And then at the other end of the continuum is individual yoga therapy, and one of my influences has been a psychotherapist called Yalom, a master psychotherapist, and he says we need to create a new therapy for every client, and which very much to me fits within the yoga therapy idea, that it is about a yoga therapist and an individual person meeting, and an assessment taking place, a very broad assessment that looks at the all kinds of issues in that person's life, and what their needs are, and what the conditions are that they're experiencing. But yoga therapy doesn't work with conditions, it works with people who might be experiencing specific conditions.
And just moving on to a different topic with the role of the Australian Association of Yoga Therapists. Mm-hmm. You've been involved with that association, and would you like to tell us a little bit about your involvement, the association, and perhaps the role you see it playing in yoga therapy in Australia?
Sure. I'm not currently on the association anymore. I was on the association for the first couple of years from its formation. And look, I think that association has come along at a very important time in Australia. Lots of people there are a lot of people who've actually been practicing yoga therapy in Australia for some time, and yoga therapy itself is actually not new. It's not a new practice, it's a very ancient practice, and probably in some ways I think yoga therapy is going back to some of the roots of how the early yogic teachings were delivered in a very individual, tailored fashion. So the AAYT really started as a group of people who were very interested in bringing together people who wanted to either further their knowledge and understanding and working as a yoga therapist, or people who were already doing that and needed to create some sangha and community around that kind of work. So probably the main role of AAYT at the moment is to be clarifying what this thing called yoga therapy is actually about, and what the training standards or qualifications are that might actually enable a person to feel confident or comfortable working as a yoga therapist.
And where do you see it all going in terms of yoga therapy in Australia?
It's an interesting question. I wish I had my yogic crystal ball. Look, I think yoga in Australia is growing in all sorts of areas, and my hope, I suppose, is that yoga therapy continues to grow and to be recognised as a significant profession in its own right. And certainly for me, the things that I have learned through yoga and what I do with my clients, which I call yoga therapy, has so much more breadth and depth than what I was able to do with people before. So the ability to work with a person in a holistic way, to work with body, to work with breath, to work with the mind from the paradigm of yogic philosophy is, I see how enormously powerful that is. And I see the enormous healing capacity of yoga at that deeper level. So I really hope that more and more people start to understand what yoga therapy is, and that more and more clients have the ability to access skilled, qualified, experienced yoga therapists who can help assist them to really engage in a deeper process of healing.
Do you have any other further comments that you want to make about yoga as therapy or any other related issue?
Maybe just one thing I'll mention is from my professional experience, one particular specialisation, I guess, that I have in my counselling work is working with people with eating disorders and body image concerns and weight management issues. And for me, yoga therapy has been a wonderful tool at working with people who may have quite conflictual relationships with their body. So many people I see first come to me, their mind over here, their body over here, and this enormous chasm or this conflict and war in between them. So I think that the whole philosophy of integration through yoga, of learning to live in this body and to be practice ahimsa and be gentle and kind to ourselves is an enormous part of what yoga therapy can offer to people, not just in that area, but probably for all of us in living more comfortably in our own skin.